Welcome to the Caregiver Education Group. We're thankful that you're watching this, and we hope this is a resource and a tool for you as a caregiver while your loved one is hospitalized here. In this presentation, we want to make sure that you get a better understanding of what to expect while your loved one is in the hospital, who the care team is for your child or loved one, what our goal is while your child is here, which namely is crisis stabilization, which we talk about more later. What to bring your child while they're here, what family participation looks like, what programming and school is like for a stay, how to prepare for discharge, and manage your child's well-being at home. So we want to say right off the bat that we appreciate you being here. We also ask that confidentiality of other caregivers is respected and personal information is not shared outside of this meeting. One of the reasons for creating this presentation was that we understand that when someone's loved one is in crisis, that means the whole family and others involved are also in crisis. We know that intake can be overwhelming for many reasons. So this is another touching base point for you all to get a refresh on what your child's stay at Prairie Care entails. Support from others is a really important part of supporting your child, and we want to make sure that you all have this resource. So NAMI Minnesota has free support groups, both online and in person, for caregivers of children dealing with mental health concerns. And this can be a really great tool for connecting, supporting, and learning from other families who have gone through some similar situations. The information for these support groups is here on the slide. Um, so feel free to stop the presentation and write down the phone number or website if you need to. On this slide are a few pictures of our hospital. You'll see one at the bottom of what a typical room looks like. All of these pictures and the frequently asked questions that you see over on the left are located on our website at prairie-care.com/treatment/inpatient-hospital. So feel free to go onto that site and check out some more of those if you would like. Alrighty, so there are some different terms that we use to identify different groups of professionals at Prairie Care that interact with your child. The first one is treatment team, and this consists of your child's psychiatrist, therapist, and social worker. You'll likely be hearing from all members of your child's treatment team during their stay, but your child's social worker will be a point person for you to contact if you need to contact someone on your child's treatment team. And the social worker will also be reaching out regarding discharge planning while your child is here. So they'll keep you informed throughout your child's stay about that. Your child will also have individual therapy while they're here about every other day. And we do ask that families participate in family therapy, and that typically happens about once a week while your kiddo is here. Another term that we use here is the nursing team. So this includes nurses that are on your child's unit and the psychiatric technicians that are with the milieu throughout their days. If you do need to contact your child while they're here, their nurses line for your child's track would be the best way to contact them. Other professionals that may be interacting with your child are primary care consultants for any physical health concerns, spiritual care providers if your child requests, we have cultural liaisons, art and music therapists, recreational therapists. We have occupational therapists and our treatment education liaison. So the average length of stay here at Prairie Care inpatient is 7 to 10 days, and that includes weekends. That's also an average. We do like to point out that discharge plans are all individualized, so it can look different for every kiddo, but that's a little bit of the average, just so you all know a little bit of what to expect. Our focus while they're here is really on stabilizing whatever the presenting crisis is. So your child may leave here and you're like, okay, not everything is going exactly how we want it to. And one of the ways that we want to help with that is by developing some aftercare plans for ongoing treatment at a less intensive level of care. So that process is collaborative. We want to make sure that your child is stabilized and also that we can help provide resources that will work for your family. So you're a part of that as well. The treatment team will recommend a level of care, and then the social worker will provide some resources and help work with you to create an aftercare plan. What to bring? So, if your child needs some clothing or things while they're here, you are welcome to bring some. We ask that it's limited to 5 sets of clothing, undergarments, and socks. The main reason for that is that it's a short stay and we have a lot of kids here. So we want to make sure that every child leaves here with the items that they brought in. Um, we do ask that you avoid bringing any clothes with identifying information like their last name or school or city that they live in. Also, we ask that you avoid clothing with strings. We want to be sure that every child is safe here, and if that's not something that's a concern for your child, we do still have to consider other children on the units, so just keep that in mind. Some other things that you can bring is a blanket, pillow, shoes without laces. Some kids also really want shower shoes and any kind of religious or cultural items that are important to you and your child. And then what not to bring. So, kind of the catch-all is anything that could be a safety concern. And again, we're thinking about not just one child, but the whole unit, and sometimes even the whole hospital. So, some of those things include food, flowers, plastic bags, any valuable items, so no phones, wallets, jewelry, anything like that. Um, we ask that you don't bring in vapes, nicotine products, medications, supplements, anything like that. All medications will be provided here in the hospital that your child needs. Um, and then they are given a hygiene kit when they intake here. So that will include body wash, shampoo, conditioner, all of that good stuff that they would need for basic self care. So we do ask that you don't bring any of those items either. A lot of things are provided here, so it's more of those extra clothing items or comfort items that your child might want when they're here. If any of these products on this list are broad, it's okay. We just have some lockers that we can lock some things up in so that none of the kids have access to it. But your child will get that back at discharge. If you are trying to reach your child or you're also just wanting to call the unit and say, hey, how is my child doing today? What are they up to? The nurse's line is the best line to call. Hopefully you've been made aware of your child's track, so you can see the different tracks on the image on this slide, and feel free to write down that phone number if you don't have it already. As it says on the slide, we really do appreciate your input in your child's care and really want to collaborate with you. So we appreciate you checking in with us and your child while they're inpatient. This is just a bit more in depth about some family participation. And I mentioned this earlier, but we typically ask that families participate in family therapy once a week for an hour. Normally, it's just the legal guardians. If you have more extended relatives that are really involved in your child's care, we can take that on a case by case basis. But most of the time, we want to keep family therapy small. And a lot of the times, our focus is really on safety planning. Family therapy is ideally in person, but we do have a telehealth option as well because we know that it can be hard to get here for that. Visiting hours are from 9 a.m. to 7 p.m. daily, and all visitors must be on the call or visit list, which can be updated by guardians. If you would like to update the call or visit list, feel free to call the nursing line and get that updated for who can come visit or who can call. And then when you do come, please bring a photo ID to check in at reception, as we want to make sure that our building stays safe and secure. So again, visiting hours are from 9 a.m. to 7 p.m. We encourage visitors to be primarily caretakers, parents, or guardians. There is a limit to 4 on the visit list, but this does not include minor children. So if your child has some younger siblings or minor siblings, they can come as well. We do ask that at one time, it's limited to 3 total visitors. So however that works out for you and your family, we just ask that you be aware of that. We also ask that peers and friends are not coming to visit or calling your child while they're here. We really just want to respect each patient's confidentiality, and make sure that there aren't peers that could potentially be coming that they're unaware of. While your child is at Prairie Care, there is a set schedule, which you can see on the left of this slide. You may notice that they have set blocks of time throughout the day, and each day looks fairly similar, to create a sense of structure and familiarity for the kids. Some of the activities that they're involved with while they're here are music therapy, art therapy, occupational therapy, and recreational therapy. Those are all really fun groups that kids love participating in while they're here. Another really important group is process group. This is led by social workers and therapists in the hospital. And it's really just group therapy and time for kids to support each other. There's also school, which we will talk about more in just a little bit. There's some gross motor time. We do have some gyms and outdoor spaces for that time. And then just in general, we think that the milieu is therapeutic. We want kids to have time to rest and engage with each other in more relaxed and informal ways as well. School, while inpatient, includes 2.5 hours of classroom time each weekday during the school year. Kids can earn credit hours for their classes, and we encourage it because it's a great opportunity for kids to practice the things that they're learning and other programming in a setting that focuses on social emotional learning. So, teachers are there to help coach students around how to manage stress within a classroom setting. Students are given really individualized attention while in school. So, there are 2 teachers to every room, and typically they have a classroom of under 10 kids. They'll learn social studies, literacy, and history while here. So if you would like your child to be in school while in the hospital, someone will be reaching out to get your permission. They'll need to unenroll from your current district and re-enroll in the district here, which is ISD 287. But outside of your consent, that shouldn't be any specific work for you. If you decide you do not want your child enrolled in school here, there is no alternative programming. So your child will be in their room during that time each day. We have had parents bring schoolwork for their child to do during that time, from their homeschool, but we do ask that it be on paper because personal electronic devices are not allowed. Discharge is very much an individualized process, and it can be influenced by a lot of different factors. Your loved one's social worker will be reaching out to you to give you updates from the treatment team and to work with you to figure out when a good time for discharge is. They'll also schedule a day and time with you to come and pick up your child for discharge. Every patient leaves Prairie Care with a safety plan. This is something that a lot of families will discuss during family therapy, but we also encourage it to be a conversation between you and the patient prior to discharge. We also want the family's input on the safety plan, as well as the patient's, because you all know what will work outside of here and what won't. On our safety plans, we really want families to be able to identify some safety concerns, stressors and triggers, and warning signs. Identifying coping strategies, this is something that we focus on a lot in the hospital. So hopefully your child has gained some new coping strategies while they're here. and can list that on the safety plan. We also want to be able to identify who can support your loved one and what they can do to support. So those are things that we have on each safety plan. Some common safety considerations that we recommend after leaving the hospital are removing weapons from the home, increasing supervision of the patient. We recommend that parents administer all medications to the patient, including over-the-counter medications. In addition, while not administering medications, to keep medications locked in a cabinet or a safe, somewhere that the patient does not have access to them while you're not around. We also recommend locking up all knives, scissors, razors, any type of sharp, um, locking up ties, belts, and ropes, and any household chemicals or dangerous substances. For some patients, limiting access to the car keys might also be recommended. When your child leaves Prairie Care, your family will receive aftercare plans that will be discussed with you, and you'll get a call from the social worker on your child's team throughout their stay to discuss that. After discharge, it's up to you all to follow up with any appointments that were made, and treatment recommendations, as well as following up with a primary care provider. We usually recommend that appointment is set the following week after discharge. And we recommend this in case there are any medication changes that need to be monitored after hospitalization, as well as it's just good to communicate with your outpatient provider shortly after a hospitalization so they can know what's going on. If your child started any medications during their stay here, you'll receive a 30-day refill at discharge. And after that supply is gone, Prairie Care will no longer be able to fill that script. So this is also where seeing your child's primary care provider can come in handy. Another transition that can be a little daunting for kids while they're here is transitioning back to school. We do talk about this in process group a fair amount as well. But because of this, we also recommend communicating with your child's support. Sorry, communicating with your child's school about the transition, even while they're here in the hospital. So it can be really helpful for schools to know what your child might be needing as they transition back to school from Prairie Care. So I've mentioned this a couple times. You will be in touch with your child's social worker if you haven't already, while your loved one is here about discharge planning. Discharge will be scheduled prior to 12 p.m. on the day of discharge. And on that day, you can come to pick up your child at the scheduled time. You'll meet with the social worker to review aftercare plans and the safety plan, and then you'll meet with the nurse and your child to review discharge paperwork and medications. All in all, this should take about 30 to 45 minutes. One thing we like to suggest for parents to bring if the child doesn't already have it is shoes or coats for the weather. Sometimes kids come from the ED and they don't have shoes or appropriate clothes for the weather, and it's always nice for them to be able to leave here with what they're needing. We recognize that there can be a lot of concerns around this transition time from parents, and some of the things that we try to address in family therapy and in our safety plans are listed here. Um, there might be some changes in the expectations at home or the privileges for the child. This could look like a change in cell phone use or driving privileges or how much time they can spend alone. Additionally, families have expressed concern in the past about what to tell siblings or family and friends, or others you might be interacting with regularly. So, those are really great things to bring up in family therapy and be creating a plan around now while your child is here. In the case that your child is not feeling well after they discharge, we recommend reviewing the safety plan and making any changes as needed. Um, Potentially connecting with their outpatient treatment providers like their doctor, therapist, case manager, or any school-based providers to get recommendations from them. And if you are concerned for your child's safety, please call 988 or your county's crisis team, which can be found at the bottom of your child's safety plan from Prairie Care. You can also contact Prairie Care through the Families First admission process at any time, and that number is listed here on the slide. If your child is experiencing a medical emergency, you're going to want to call 911 and get them seen as soon as possible by a medical provider. Thank you so much for trusting us with your child's well being for this period. And thank you also for watching this. We hope it's been a tool for you in feeling equipped to care for your loved one while they're here at Prairie Care.